Every emergency medicine physician needs to have the skill set of point-of-care ultrasound. It's ingrained in our specialty. We're one of the leaders in it. When it comes to training here at SIU, we take a longitudinal approach to teaching ultrasound, which may be a little bit different than some other institutions. Traditionally, most residents, when they go through a training program, they have a specific month dedicated to ultrasound, learning how to do probe manipulation, learning how to obtain images and to interpret them. And usually that experience is very early on in their career. When we first initiated our ultrasound curriculum and did that type of a traditional model, what we found is that although our residents had the skill sets to perform the ultrasounds, since they were so early in their career, they were still learning how to practice medicine, how to take care of patients, and maybe they didn't integrate it into their practice patterns. So what was decided is we kind of have three main components of our curriculum, and we spread them out over the 3 years, just so that the exposure to ultrasound is continually there to remind them so that they can actually start integrating the knowledge in their clinical practice.
Residents have dedicated scanning shifts with either myself or Dr. Dela Cruz, where we go to the bedside and do real-time scanning on patients who have presented for a host of different reasons and get real-time images and then work on both image acquisition and interpretation at the bedside with the residents. I feel like the ultrasound shifts are a big part of our curriculum because it allows us to provide real-time feedback to the residents at the bedside. So it's not learning on a mannequin, it's learning on an actual patient who is presented to the emergency department for a specific reason, and then working on obtaining those images and then accurately interpreting them in real time. From there, the images are uploaded into our server, and then Dr. Dela Cruz and myself, and then any resident who's rotating through that specific rotation will then review them during our quality assurance sessions.
We actually quality assure as ultrasound core faculty, and what we've done is we've created this somewhat of a competition. It's called our Ultrasound of the Block competition. All the ultrasounds that are gathered, some are picked out for educational value. Those that are picked out, those residents get points for performing them, and then every block we do a quiz online that goes along with the clinical vignette. It has their images, and then as the residents answer those questions, they get these point totals. Once a block, we review all those ultrasounds as a group, and then we kind of release the point totals at the end of the year, where we kind of have some fun with it.
I think that ultrasound is important, especially in more resource-limited settings, so rural areas. If you have an ultrasound, you may not have a CT scanner, but if you have an ultrasound, you can do a lot at the bedside. You can look at a lot of pathology and figure out a lot of things on your own. I think having a good curriculum behind us here to prepare us for the actual real world and doing that in practice is really important.
Having it as kind of a longitudinal portion of our curriculum is nice because not only are we learning about how to perform those skills at the bedside, but we're learning kind of some of the more technical aspects of what makes a good ultrasound, what makes an ultrasound that's usable for other people to also be able to see that information, and so that it's becomes a reproducible habit.
The focus is on learning and improving residents' understanding of what's been going on, and it's less focused on grading and more upon improving their underlying knowledge of what's important and what's not.
All of that kind of helps to solidify the skill sets of ultrasound, the ability to interpret ultrasounds, and most importantly, the ability to become a more well-rounded emergency medicine physician.